Knowing your family's history of cancer is a first step to understanding your own cancer risk and may qualify you for the MyRisk Hereditary Cancer Test with RiskScore Hereditary Cancer Test. It's easy, accurate, and covered by most insurers. Learn more at getmyrisk.com.
Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair loss, or insulin resistance, you might be dealing with PCOS, or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created OV. OV is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. OV offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to OV.com. That's OVII.com and start today.
Guys, I have to tell you about this amazing new podcast by the pioneer of conscious parenting, New York Times bestselling author, clinical psychologist, and Oprah's favorite parenting expert, Dr. Shefali. It's called Parenting and You. This is not your typical parenting podcast. Dr. Shefali talks to real parents in real time and helps them tackle their everyday parenting challenges using conscious strategies to raise empowered and resilient children. She helps parents overcome obstacles that get in the way of creating authentic connections with their kids. No matter what struggles you have, you will receive profound wisdom that will resonate deeply with your own life experiences. I highly recommend Parenting and You with Dr. Shefali on Apple, Spotify, or wherever you listen to your podcasts. Hi, I'm Mary Alice Haney.
And I'm Dr. Thais Aliabadi.
On today's episode, we have Hannah Storm of SportsCenter and ESPN. She's a true trailblazer who had breast cancer, and we heard about her journey today. It was incredible. She's really a badass.
She's amazing, and I'm so happy that her cancer was diagnosed so early. That's why it's so important to do your mammograms. Without a mammogram, her cancer would have advanced and she would have completely missed it.
So tune in. You're really going to want to see this episode. Hannah Storm, we're so happy to have you today on SheMD. So I have to tell you right now, my boys love SportsCenter and they love 30 for 30. And I know you did the documentary with Chris Evert. And you're just a badass. And you know, we talk about this all the time, empowering women. That's why we started the podcast. We want to make women their own advocate. And you really did. I mean, you were kind of it for a while, and you were this badass trailblazer. Can you just tell me about your background? I know your dad was in sports, but I want to understand kind of how that happened. I love origin stories.
Yeah, so when I was growing up, this was not really, there were no women on TV talking about sports, but I did grow up around sports because my dad was a sports executive. So when it wasn't a school night, we would head to a basketball game or a baseball game, and I loved sports. Like, I loved everything about it, the competition, what makes people tick, you know, how they handle winning, losing, you know, why they excel. And I was also a real ham, and I was in a lot of plays and musicals, so I like performing. And when I got to Notre Dame, I thought, well, you know, why don't I kind of combine that? So I did, you know, radio show. I had a sports talk show. I was a DJ. I worked for the local TV station. And then the summers I would do internships, you know, kind of beg my way into whatever TV situation I could, and then wait tables for money for school. But when I got out of school and started really interviewing for jobs, it was really rough. Even though I had a lot of experience and I had a tape back in the day, that's what we had, not a link to our work, but a tape. Just it ran the gamut from, my sports director doesn't want to work with a woman. My audience won't accept a woman doing sports. I'll hire a woman over my dead body. It's kind of hard to imagine today. So then my dad, I was really lamenting this, sending out hundreds of, which you did back then, cover letters and tapes and so forth. And I'm not exaggerating when I say hundreds. And getting all these rejections. My dad was like, listen, there's a lot more radio stations in the country than television stations. Your odds are better. You just need one single person to say yes. I always liked that philosophy. Mm-hmm. So then I started answering want ads. I went downtown in Houston, made up a couple of radio tapes, wrote them, recorded them, started answering want ads in the back of an old publication called Radio and Records. And there was another publication called Broadcasting Magazine. And I got a couple job offers. And the one I took was to be a heavy metal DJ in Corpus Christi, Texas. And that's where I got my name, Storm. That's actually my DJ name is Storm.
No.
My real name is Storin, but Hannah Storm, C101, By the Sea, spinning Quiet Riot, Def Leppard, and Scorpions, back to back to back, Van Halen. Yeah, it was like the Headbanger era. So that's how I got started. Isn't that funny?
Oh,
and then I kept answering ads. Yeah, and then I ended up getting a sportscasting job at a rock station in Houston. So...
So music has. Do you play music? Do you love? I mean, was there anything, or were you just literally?
Okay. No, I love music as one of my loves. And when I was hosting the early show on CBS, I got to interview and get to know a lot of musicians. And then, honestly, played so much music in the car and stuff that my oldest daughter basically did. She's in the music business. She lives in LA, in Echo Park, and she's a manager. She manages.
Well, if she needs anything, she needs a doctor. I know one.
She needs a doctor. I know one now. Yay. That is a really hard thing. I got to say, when your children leave the house and they go to another city, finding a doctor, finding care, it's really, I think it's, it's kind of a difficult thing,
We were actually, it's so funny, before with the podcast today, we were actually talking about, since we started the podcast, we've been getting texts and emails and everybody saying, how can I find a doctor like Dr. A? I need to see Dr. A, and the response, for us has been, we don't want you to need to come see Dr. A. We want to give you the information to be your own health advocate so that you could go to any doctor and be more, so educated that you could say, I have PCOS, I've got dense breasts, I've got whatever it is. But you're right. As a parent, we're both, our kids, her kids, both of our kids are off at college, and it's when they go to a town that you don't know, and you're sort of how do you find the gynecologist? How do you find the dermatologist, the psychiatrist? It's this kind of a scary thing. And I think...
Or you bring him back home.
Or you bring him back home. Exactly.
I mean, and then it just gets that much harder with insurance and state to state, and it's just impossible. I think, especially in the areas of mental health, I think they make it, it's very, very difficult to get any kind of help. I mean, we could go down a whole insurance rabbit hole, which I don't want to do, but even for, on a different subject, like my foundation, so I fund surgeries for kids who suffer from vascular anomalies. Okay, so that's a really disfiguring birthmark, right? If you half your face it looks like someone spilled wine on your face. Maybe that's a common one called the nickname is a port wine stain, and we do those surgeries, but. The way that the insurance codes are written, they're all considered plastic surgery, even though you could, lose your eyesight. You could lose, there are very serious consequences or birthmarks, not only on the surface, on the brain, on your limbs that cause huge problems. And so that's one of the things that we do is flat out fund these surgeries for families who don't have any recourse or anywhere to turn.
Insurance companies don't pay for high-risk women to get their breast MRI. They don't pay for the most basic services that these women need. I paid almost $3,000 for my breast MRI when I had atypical cells growing in my breast.
That's
because
insane.
They told me it was not medically necessary.
Yeah, I mean, The other thing, and this is another issue, is that I work with veterans. And so I work with a lot of women who are, maybe they're in a wheelchair, they're disabled, in some way. It is so hard for them to get gynecological care, to just find somewhere, believe it or not, to find a medical facility to get something like a mammogram that is actually wheelchair accessible, or where the equipment is able to accommodate their disability. This is like a real thing with disabled women. Like they're not viewed by a lot of doctors as like even human,
Hannah, how did you get so involved with veterans?
So for years, I hosted our Veterans Day specials on ESPN. I've been all over the world with our veterans. And as our relationship sort of evolved, and this is through sharing my breast cancer story, like you never know where it's going to go. This is a huge issue for our female veterans, is getting proper gynecological care. And what is just so heartbreaking, because they've given everything for our country. A lot of times they are coming back with just these broken bodies and these lives that they have to carry on. And I find that so beyond the pale. I find that so wrong. And I'm doing everything I can to raise awareness for that.
So if someone listening right now, what can they do when they hear this? Is there a link that we could put on our podcast?
Paralyzed Veterans of America.
Okay.
And is there PVA.org? Is there you know what? I'm really curious. Next time I go get a mammogram, are you wheelchair accessible?
Okay.
Do you have the ability?
You have to.
Your offices.
Yes.
Okay.
Yeah, right. But what I was saying is all the newer offices have to be accessible.
They have to be, but I mean, try going somewhere like, you know what I mean, to a smaller city, or somewhere that's, doesn't have an incredible facility like you do. So,
but Hannah, the problem is,
go ahead.
These patients can't even make an appointment.
Right.
Even if you don't have disability and you call, I have patients come to me and they're like, I have a migraine headache, for example. My appointment, I don't know, it's September. My appointment is next April. Like, what is this patient supposed to do until next April?
That's right.
There's really a shortage. There's a shortage of doctors, but I'll tell you why. They don't make it easy on us to become doctors. And then when we become doctors, we get abused by these insurance companies with the payments.
Right, you're not making money. You're not making money.
I mean,
I understand.
Doctors make $80 to see a patient. At some point, you have to incentivize people to work, right? And to wake up and to come to work. And when I was a resident, we used to make a joke out of this, but I would get paid. My salary for the entire year, for the number of hours that I was working, would come out to be $1.50 per hour. That's what they do to us. Do you know what I'm saying? And
it's a broken system.
It's a broken system. And I hate to say it, but you're in sports. Doctors, teachers, we compare ourselves to, athletes. And look at our teachers. They're so underpaid. Of course, no one's going to want to become a teacher unless I wanted to be a doctor. This is my passion. I love being a doctor. But if you don't really love it, I have so many friends that went through medical school, did residency. I talked to one of them 2 days ago. He's like, I'm retired. It's cheaper for them to stay home than to do this. So my point is, going back to what we were discussing, patients can't even get an appointment to be seen.
And the sad thing is, because of what you just said, so many doctors are out of network. So when you're talking about mental health, which we have a mental health crisis in our country, and we have such a need for mental health professionals, they're all out of network, because if you're in network, you're not going to get paid, because it's not valued. And it's just, it's really tough. I mean, it's really tough. So I appreciate the two of you advocating.
Well, that's
advocating
honestly
for better healthcare. I mean,
we need robotic doctors. We really do. People don't like it when I say it, but robots will make a huge difference. Robot will not dismiss women. They will not dismiss our symptoms. They will listen. They will not miss a diagnosis. It will change the healthcare system. I would love to have 5 robots with me all day long. And
she would. She wants to create all these robots.
I do. I want mini Aliabadi robots everywhere. And
I like it.
You know, and my dream is one day when I retire to just open up my practice and just see the underprivileged people. That would be my dream.
Yeah.
And I've talked about it for years. I would love to do that, but there's a huge need. There's a void. We need more doctors.
But you're right. For these women who have literally served our country, risked their lives, and they come back this way, and to not take care of them, that is a societal fail, and we've got to do better. So we're going to put the website links on our website for you. Cozy Earth's Luxe Bath Sheets are impossibly soft and plush. These towels are crafted with a unique blend of cotton and bamboo viscose using innovative zero-twist technology. Cozy Earth's bath collection delivers that plush, spa-like experience. Plus, Cozy Earth's products are designed to be highly absorbent, making them perfect for drying off quickly after a bath or shower. Cozy Earth uses eco-friendly, sustainable materials like bamboo and organic cotton, which are gentle on the planet. The fabrics are soft and breathable, and they hold up wash after wash, so you can enjoy them for a long time without noticeable wear. Cozy Earth offers a range of designs and colors, making it easy to find something that fits your aesthetic. If you prioritize sustainability and comfort in your home goods, Cozy Earth could be a great fit for you. Their goal is to help you create a sanctuary within your home, a refuge from the demands of the outside world. With Cozy Earth, you can transform your space into an elevated haven where serenity and renewal intertwine effortlessly. Go to cozyearth.com/SheMD and use code SheMD for an exclusive 40% discount. If you get a post-purchase survey, say that you heard about Cozy Earth from this podcast and they'll send you a free pair of socks. Upgrade your nights and transform your days with Cozy Earth. Do you ever feel like you just can't get all your veggies in your diet? I know I'm not alone in feeling like I'm constantly rushing from one task to the next with hardly any time to make sure I'm eating balanced meals. With AG1, I love that I don't have to worry about what I'm putting in my body when I'm on the go, and that is because AG1 is a foundational nutritional supplement that delivers daily nutrients and gut health support. It's backed by multiple research studies, so you can trust what you're putting in your body. Sometimes I feel like I'm always bloated, whether I eat a big meal or a small meal. There's nothing worse than feeling bloated, and ever since I started using AG1, I've noticed a huge difference. And I love that AG1 has prebiotics, probiotics, and digestive enzymes for gut support. It has been known to alleviate bloating, promote digestive regularity, and aid in digestive comfort. If I had to recommend one product to support whole body health, it's AG1. So start with AG1 and notice the difference for yourself. It's a great first step to investing in your health. That's why I'm so excited to be partnering with them. Try AG1 and get a free bottle of vitamin D3 K2 and 5 free AG1 travel packs with your first purchase at drinkag1.com/SheMD. That's a $48 value for free. If you go to drinkag1.com/SheMD, check it out. Equip is a virtual, evidence-based eating disorder treatment program that helps you or your loved ones heal your relationship with food. We talk a lot on SheMD about how food can impact your physical health, but your relationship to food and your body can also have a huge impact on your mental health. Eating disorders often go unnoticed because they don't show up how we expect them to. Anxiety around mealtimes, exercising when you're sick, feeling out of control around food, or extreme picky eating could all be signs of an eating disorder. My friends and I talk a lot about how when we were growing up, so many of our friends and family members had eating disorders. No one talked about it, and a lot of people didn't get the help that they need. I'm so thankful that that's no longer the case. Equip treats people of all ages and has no wait list. They offer a comprehensive virtual care that includes therapy, nutritional counseling, and support for both patients and their families. Equip emphasizes the role of family in recovery, providing education and support to help loved ones understand and assist in the healing process. Their platform allows for regular check-ins, ensuring ongoing support as needed. If you think you or a loved one could be struggling with an eating disorder, Equip can help you achieve lasting recovery. Visit equip.health/SheMD to learn more. That's equip.health/SheMD.
And I want to chat about, I can't even count the number of women we've had on this podcast who also had breast cancer, because I had breast cancer 5 years ago. And last time we had a podcast, out of 4 of us, 3 of us had breast cancer. So it's unbelievable, and there's still so much misconception about breast cancer and everything around it. So do you want to tell us how your breast cancer was diagnosed?
And it's a crazy story because you're best friends with Chris Evert. She had ovarian cancer, right? And her sister died of ovarian cancer.
Right.
Oh, I didn't know that.
Yeah. Tell everybody the story. I think this is incredible.
So I have a really good friend, a guy friend of mine from Notre Dame, and his brother died of cancer several years ago, and he has this huge fundraiser, and every year they invite just one person who a loved one or themselves closely affected by cancer as a speaker, and it's usually a celebrity. He wanted Chrissy for years. So finally, because Chrissy was going through a lot of her own surgeries, and finally I was like, Chrissy, please, like, I know you normally don't do this kind of thing, but please come up here and please do this fundraiser for my friend. Chrissy's also really close to my husband. So she came up really as a favor to us. That's all I can say. And she said, listen, can I bring my doctor, and you can interview us on stage, and we can really educate the people at this fundraiser rather than just me giving some sort of speech. And I was like, great. So her doctor's name is Alice Port, and Alice Port is the director of the Dubin Breast Cancer Center at Mount Sinai in New York City. So we do this amazing interview. We talk about it. I think people are, really, in sports, it's a largely male audience too. So it's like really, really great for them to hear about things like this. And so we went through the whole thing, blah, blah, blah. Then I had the next week, it was really close. I had my mammogram, and I think it was my first one in 16 months. And normally I'm pretty good about it, doing it every 12 months. But I don't know, for whatever reason, I hadn't had one in 16 months. So I have my mammogram. So I have dense breasts, which, as you know, isn't 50% of women, or 40 to 50% of women have that. Right. So it just means, in essence, it's really hard for sometimes just getting a mammogram to detect whether there's anything abnormal going on. That's again, it's bare essence. So I go in, I get a mammogram. I don't hear anything. Nothing. I don't hear, I don't get a report. My doctor doesn't get a report, nothing. A couple of weeks go by and I'm like, that's really weird. I didn't hear anything. They didn't call my GYN, no, there was no word. So I'm like, well, this is weird. So I had to proactively go back, track down, the records at the hospital to say, well, what did my reports say? Because nothing is not okay. And they said, oh, you have, dense breasts. So you have to have an ultrasound. And, I've always had dense breasts, and some years I've had an ultrasound, some years I haven't. And it just, to me, just felt very arbitrary. Right now it's different. Now they say if you have dense breasts, you really should have an ultrasound. That's an across the board recommendation. I'm really glad that happened. So again, you have to be proactive. Nobody said anything. Yeah. I had, tracked down the information. So sure enough, then they're like, now we see something. We don't know what it is. It's probably nothing. But, we'd love you to have a biopsy. So I have a biopsy, and then the doctor says, oh, I'm so surprised. You have DCIS, ductal carcinoma in situ. So first of all, the language that was used, it's probably nothing. Okay, people don't want to voluntarily go in and have someone stick a needle in their breast. So, if I wasn't one of those, I don't know, I'm going to run out this ground ball, if I heard, it's probably nothing, we don't think it's anything, I might not have done it. Right. I might have just put it off. And then to have something found and to say, I'm so surprised, I wasn't loving that language either. So, so I went right home and I said, Chrissy, I need Dr. Port's number. And she's like, what's going on? I'm like, yeah, well, basically you left this dinner and I got diagnosed with cancer. And she's like, oh yeah. And I went back home and I got a recurrence of my cancer. So we're like, oh, great. Here we are.
Yeah.
Here we are.
Okay.
Yeah. So anyway, and then, thank God. And I had a lumpectomy and do not need radiation. I take tamoxifen, which is a drug which a lot of women who've had breast cancer take. But so many cool things happened. Like I did genetic testing and, I don't have any genetic predisposition to breast cancer. I had no lumps. I had no pain. I had no symptoms. I have 0 breast cancer in my history that I know of. Like nothing that would ever indicate that you would have breast cancer.
So that's, we hear this again and again and again. Yeah. Same thing with Thais. So, I mean, you want to...
I would say you're the typical patient who would come with breast cancer, right? Breast cancer, 85% of patients who get breast cancer don't have it in their family, number one. Right. Less than 5% of patients have a gene mutation associated with breast cancer. So majority of us, I didn't have family history. I've never smoked. I've never done drugs. I don't drink alcohol. I've never been overweight. I put a check mark in front of everything. But I did have extremely dense breasts. I am tall. I had children after 30. So there's so many factors that can with all of those. So you can't say I didn't have any risk factors. We all have some risk factors that add up, and that's why it's so important to know your lifetime risk of breast cancer. To this day, I have patients who come and they're like, I don't need a mammogram. I never had anyone in my family. I mean, at what point are we going to learn that that's completely false?
Yeah, I hear that all the time, and I have really good friends who just don't go. They just don't do it, And I think a lot of women too that are, let's say you're taking care of your kids and you're working, and you're taking care of your elderly parents, and you're just so busy taking care of everyone else that this is just not on your priority list.
So Thais, can we go back for 1 second and talk about 2 things that I think that every woman listening wants to know is, how do you know if you have dense breasts? Okay. What do you do if you have dense breasts? And what does every woman that comes to your office do? Because every genetic test is not the same. Right.
A lot of patients come and they touch their breasts and they're like, oh, I don't have dense breasts.
That's what I thought before I saw you.
That's
I was
false.
Like, these little boobies are a little bit lower, but they're not dense.
So that's false.
And it has nothing to do with the size of your breast either.
Correct.
Okay. Yes. Okay. Let's just get that out of the way.
Exactly. Absolutely. And dense breast is a finding with, through imaging. Like with your mammogram, if you look at your mammogram report, there's always a comment about the density of your breast. Breast tissue is made out of glandular tissues with the glands where milk comes out, connective tissue that surrounds it, and fatty tissue. And what happens is patients with dense breasts tend to have more glandular and connective tissue versus fatty tissue. As we get older, we replace that connective tissue and the glandular tissue with more of the fatty tissue. So as we get older, our breasts are less dense, but young girls, they have really dense breasts. And that's why doing a mammogram in a 25-year-old, you have to do it if you have to do it, but it's not going to show anything. And you have to add ultrasound to it, because when the tissue is that dense, mammogram can miss lesions. Now, there are different types of mammograms. We have 2D mammogram and we have 3D mammogram. And the 2D mammogram is just an x-ray of your breast. It's 2-dimensional, and you get overlapping of the tissue. So the areas that are dense basically look white. So the radiologist looks at it and says, well, I don't see anything, because you really can't see much. But when you do a 3D mammogram, it changes everything, because you can see layers. It's like peeling, it's like flipping through the pages of a book, right? You can see, you can look through the breast tissue a page at a time, layer by layer. So it's more accurate. You're more likely to catch any abnormality. Patients with dense breast tissue need to have breast ultrasounds. It's a must, because, like I said, you can miss a lot of lesions.
I mean, mammograms have to be the first step. You can't,
Yes.
like,
Yep.
don't ever get the mistaken impression that a mammogram doesn't work. Correct?
Absolutely.
Right.
It's the number one screening method we have. Mammograms miss about, so they pick up about 4 out of 5 cancers. 20% of all breast cancers get missed on mammogram. And that the group where we miss it is usually patients with really dense breasts or extremely dense breasts. So when you add an ultrasound to that, then, you know, you try to close that gap. Now, for patients who are high risk, meaning their lifetime risk of breast cancer is 20% or more, then in addition to mammogram and ultrasound, they also need to do MRIs of the breast. And we start that imaging sometimes as early as 30 and not 40.
And what is that high risk? So what does that mean?
So basically, in my office, I use the Tyrer-Cuzick risk assessment tool. It's just based on history, your height, weight, density of the breast, age of your period, age at which you had your first child, well, your family history, whether or not you're Ashkenazi Jewish, whether or not you've had the BRCA testing. So you answer all those questions and it gives you your lifetime risk of breast cancer and your risk over 10 years. So and I usually use the lifetime risk. And if that lifetime risk is 20% or more, it puts you in a high risk category, which means you have to start imaging much earlier than 40, right? Or, and you have to supplement with MRI.
Okay.
And the other thing I want to add is if you have a family member who was diagnosed with breast cancer at age 38, let's say, you have to start imaging 10 years prior to the age of diagnosis of your family member.
And then isn't it true, my grandmother had breast cancer, but she didn't have breast cancer until she was 80. So that's just kind of considered.
No, that's still your first degree relative with breast cancer.
Even though it was after 80?
Yeah.
Oh my God, I didn't even know that.
Yeah, it's your first. And it could be your paternal grandmother. I still have patients that are like, well, I don't have anything. My paternal aunt got breast cancer at 42, but I'm fine because it's from my dad's side of the family.
No.
What is that supposed to mean?
Right,
What?
right.
No.
I mean, honestly, like whether you're, and you're talking about assessments, which I think really come into play with age, right? So do you need more screening than sort of the average woman? Or do you need earlier screening too, more earlier than the average woman? But still, you have to follow the guidelines, like no matter what. Right?
Right.
No matter what your score is, I mean, you have to have this and you should be doing it every 12 months and don't just arbitrarily say, oh, I'm healthy, I'm fine, nothing happened last time, I think I'll wait a couple years. Like you literally can't do that because you never know. And breast cancer is so curable.
Right. If you catch it early. Yeah.
If this is what you have, you are very lucky. If you have DCIS and you catch that, you're not going to die from that.
Yeah. Exactly.
So, it's just, can't overstate just how critical it is.
And Hannah, you said you did genetic testing. Did you?
Afterwards.
Afterwards
I did not. Yeah. So afterwards. And by the way, genetic testing is not scary. It's not expensive. It is a blood test. And I do not have which you mentioned, maybe you want to talk about the BRCA gene. Chris Evert did have the BRCA gene. So she had preemptively had a mastectomy as well as the rest of her surgeries.
Hannah, I have a question for you. Did you have a family history of any other cancers?
My dad, the only person in my family that had cancer was my dad, and they couldn't diagnose it. They couldn't figure out what kind of cancer it was, which is really strange. So it never really had a name, but they're like, your dad had cancer. And the sad thing is it was during COVID. And so he wasn't able to get the surgery that he needed probably as quickly as he needed to. Again, because it was in the COVID era. And so by the time he was able to have surgery, he died from his complications from his surgery. But my dad was the first person in my family. And then come to find out, 2 of my cousins on my dad's side also had cancer. Men, all 3 men. Okay,
Yeah.
but that's cancer in your
But,
family.
right. So that's
not,
what I,
doesn't mean I'm not going to get breast cancer, right?
Right.
Yeah.
and right now there's we've had this guideline, but if you have one family member with prostate cancer that's aggressive, insurance will pay for you to do genetic testing. One family member with pancreatic cancer, these are unrelated, right? It could be an uncle. So if you have a first degree relative, one prostate, one pancreas, one ovary, two breast cancers above 50, one breast cancer under 50. The list goes on and on and on. Insurance, one colon cancer under 50, two above 50. Insurance will pay for you. And let me tell you, I use the MyRisk test in my office. I've used them for 10 years. And the reason I use MyRisk is not only, people always talk about BRCA, and I want to make this very clear. Yeah. BRCA is only 2 of the many genes we check. Yesterday, I had a patient in my office that I diagnosed her with CHEK2. And CHEK2 gives you breast, colon, and prostate. Right?
That's a gene.
That's a gene. CHEK2 is a gene mutation, but it has a 50% lifetime risk of breast cancer. It's not BRCA, but it's enough it needs to be diagnosed and it needs to be treated.
I just went and got my mammogram and my ultrasound because I have dense breasts.
Good for you. Yay.
But I just kind of keep wondering, like, if men had to stick their penis in a machine that squished it every inch of his life, do you think that they would do that? I literally, like, my boobs were stuck in there. They're pounding on them. It's just it's
not fun. No.
It's not fun, but it's needed.
Of it. Listen, people know, this, people are scared of doctors anyway. They don't trust doctors. There's a whole segment of people, especially, I would say young people, that are just very, very skeptical. And, then you go there and it's so unpleasant. So, a lot of what I do is I talk to men and I'm like, you take the day off if you have to. You make the appointment, you drive your wife, you go with her and you support her and make sure she gets her mammogram. Like, that's part of love. Like, that's part of partnership. And I guess because, I have a large male audience, I think they need to get involved and advocate and understand that this isn't fun. And it's not pleasant. And who wants to sit there and make an appointment for something that's unpleasant, and find a babysitter and take time off work and like everything else that you have to do? If you love someone, if it's, your friend, your sister, your partner or whatever, jump in.
I was wondering about that because you are in such a male, you were very public about your breast cancer and you came out and you talked a lot about it, which was so amazing. Were you surprised at the response, from your male colleagues? Did people treat you differently? How was the response?
Well, I think the response was across the board. I think I always kind of, in everything I do, it's pretty intentional. I want to, just like being the first female sportscaster, like I wanted women who came behind me to understand that this was a career option, right? Like that was really important for me to establish that. And I also wanted to, by sharing my story, I really did want to demystify it. And so I wrote a very detailed article, which I posted on ESPN. So for all our employees, like anyone at Disney that could read it, but like explaining it, right?
Yeah.
And then, went on with Robin Roberts, and then I did like a People magazine. Yeah. And I went on SportsCenter and talked about having breast cancer.
I love it.
I'm like, who else is gonna get to be on SportsCenter and talk about breast cancer? Like, 100%. So, I would say it's just across the board. Most people, I think, just care about you as a person. Yeah. And I do think in the sports world, which is really great, is that we used to only talk about like X's and O's and things on the field. And now we do talk about things, and we talk about more things now than ever in sports that do affect women. So I just feel like, the door is open, and it's really hard to talk publicly about health things, as you guys know. Like, that's not easy. And I don't take for granted when someone shares a story like that it is anything other than really difficult to share that part of yourself, especially in the sports world where we used to all right, I'm hurt, but I'm gonna play with pain. Like, well, let's go. Let's soldier on. But I do think by making understanding your vulnerability, sharing your story as well as you can, and using your platform. I mean, you legitimately, why are we doing this? We're trying to save people's lives. I mean, that is what your podcast is about. That's what I'm about. If, 10 people go out and have a mammogram because they heard this, great, So that's just sort of my philosophy. And that's why I'll keep talking about it.
This Menopause Awareness Month, we're so excited to partner with Equal, a non-prescription menopause symptom solution that has been clinically studied and is recommended by over 1,500 healthcare professionals across the U.S. Backed by decades of research, Equal's key ingredients, S-Equal, is a plant-based ingredient that mimics the effect of estrogen to relieve the most bothersome menopausal symptoms. Start your journey towards menopause relief today with ongoing health benefits with continued ease. Many women in perimenopause or menopause do not feel like themselves, not just hot flashes. From mood swings and occasional sleep disturbances to muscle aches and pains. Symptoms of menopause can cause discomfort in many ways. Clinical trials show best results at 12 weeks. So their 90-day money-back guarantee ensures you can give it a good try without the worry of wasting your money. There is no symptom too small, and women deserve to have their menopause symptoms taken seriously and addressed. If you want some help reducing symptoms of menopause, visit equal.com and use code SHEMD20 at checkout for 20% off your first month with your first subscription. That's EQUELLE.com and use code SHEMD20 for 20% off your first order. And the best part, their 90-day money-back guarantee. So you've got nothing to lose. Meet Aria, your go-to guide for all things sex and intimacy. Aria makes it easy for couples to break out of their routine, deepen emotional connection, and energize their relationship. With curated experiences called scenes. Just take a quick quiz about your relationship, and Aria's concierge will send you everything you need to explore something new every month. You'll get expert insights, step-by-step guidance, and a box of high-end goodies delivered right to your door. Aria takes care of the details so you can focus on each other. People come to Aria for many reasons, whether they're stuck in a routine, seeking deeper emotional intimacy, or wanting to infuse more play into your relationship. Aria makes it easy for couples to connect by crafting customized, intimate experiences called scenes, tailored to your needs. If you've been wanting more intentional time with your partner, look no further. Aria has you covered. Every piece of the scene experience is designed to be interacted with and shared. Couples often use the concierge to learn more about their preferences and share about it with their partner. Aria takes all the thought out of trying new things with your partner. They set you up with a dedicated concierge who is available anytime you need them and sends tips and tricks weekly to help you get started. It's easy to get started with a fun, private quiz to understand you as a couple. Use what's in the box to think outside of the box. Use code SHEMD for 15% off today. Let me tell you what I like about ZocDoc. It's the place to find and book doctors who will make you feel comfortable and take the time to listen to you. This comes up a lot on SHEMD. It can be really hard to find a doctor or medical practitioner who feels like a good match. With ZocDoc, you have so many options, including access to tens of thousands of doctors who all have verified patient reviews. I'm so lucky that my partner on SheMD is a doctor, and I get to call her and ask her any of my medical questions. But before I met Dr. A, lots of times I really had a hard time finding the right doctor. I had to compromise a lot on my medical care. Many times the doctor that I wanted to see wasn't available, but you shouldn't ever compromise when it comes to your health. You can search for doctors based on specialty, location, and availability. ZocDoc aims to streamline the process of finding healthcare by providing information and making scheduling more convenient. ZocDoc is a free app and website where you can search and compare highly rated, in-network doctors near you and instantly book appointments with them online. Go to ZocDoc.com/SheMD and download the ZocDoc app for free. Then find and book a top-rated doctor today. That's ZocDoc.com/SheMD. ZocDoc.com/SheMD.
aliabadi.com/SheMD.
Well, I think I just want to thank you because, and we've just been so blessed on this podcast. We started it not so long ago, and Dr. A has these incredible patients with all of these incredible platforms, and they're coming on talking about very personal health things like you are right now, and they're using that. And the reason they're doing that is exactly what you're saying, is that if they can save a woman's life by hearing their story, or if they could make her life a little bit better by knowing, like Kim Kardashian talking about her psoriasis, it's like an ugly,
Right.
she felt ugly in that moment, or SZA talking about PCOS, or you talking about breast cancer, or Olivia Munn coming out and really, you guys started a revolution with what happened with her breast cancer. I just think that we're in a time right now where women are like, enough. We're not going to be dismissed. We're going to be heard, and everything we could possibly do, we're going to do to make another woman's life better. So I just thank you so much for sharing your story with everybody and for with us. It's incredible. I think. And my boys are going to think I'm so cool that you're on the podcast. I can't tell you. I can't even tell you how many 30 for 30s and sports. It's literally, I'm like, can we watch Emily in Paris? And they're like, no, Mom, we're not going to do that.
That would be my house.
Exactly.
I'm sorry, you have to watch Emily in Paris in your free time, of which I'm pretty sure you don't have any.
We don't have any. But thank you so much. And I guess I want to, before you leave, I just want to ask you just a few questions. From like, what can you tell women or little girls listening right now who want to do what you have done? And whether it's like breaking a door down or it's how, what advice do you have? I love to give advice to young girls' careers. I love your, like, for a young girl who's listening, you did the impossible. No other woman was out there doing what you were doing. And you just, you became a DJ, and then you went that direction, and then you went that direction. So I would just love to have you give us,
another thing that I've really done is like kind of bet on myself and take risks, do things that I'm afraid of in my career. Mm-hmm. So my first full-time TV job, a station in Charlotte, North Carolina, wanted me to come and do NASCAR. And NASCAR specials. And I didn't even know what NASCAR meant. But I was like, you know what? I'm really, really hard worker. I'm really smart. I think I can learn stock car racing, And even a few years ago, Amazon came to me and they said, we want you to call play-by-play for Thursday Night Football. Like, be the first ever woman to ever call play-by-play for NFL for a season. And I ended up doing it for 4 seasons. And it was really scary. And it was like jumping off a cliff and having to not care what people say and critique about you on social media and things like that. And even now I have 2 projects in the works that are going to take me in a completely different direction from linear television, and that's scary too. But I feel like being open-minded, adapting, sort of sometimes as you go along, finding out what it is people need, because that's super important. Sometimes there might be like what you want, but then there's like what do people need, right? And it's the old principle of like, what am I good at? What can I get paid to do, and what does the world need? You know what I mean? And if you can like sort of find that intersection there, that's sort of like the magical spot, that you need to be. And I think not internalizing anything on social media, I think it's really bad, really, really bad. And I do think that it does breed insecurity in young women, and making them risk averse to putting themselves out there. And I would say really, really, really try to check yourself with, and also just understand that you're smart. You know what I mean? Understand that nothing replaces hard work.
Yeah.
I would add one more thing. Just knowing you for the past 45 minutes, I would say passion. You're an extremely passionate person.
Yeah.
You need passion and effort, and you have both.
Yeah. That's the other circle. I was trying to think of the other circle. What are you good at? What are you passionate about? What does the world need? And what could you get paid to do? You can add that one in.
Exactly. And then before we close, because we are a health podcast, is
Yes.
there anything that you are doing now that you found to make yourself healthy? Is there anything that you would love to, like a secret you would love to share?
I mean, I honestly, yeah, there's a couple of things I did. I tried to get away from as many microplastics as I could. So I'm drinking water, out of a glass bottle. I have the Yuka app, and I go in and I make sure that, whatever I'm using, even my skincare, doesn't have a lot of chemicals in it, or the food that I'm buying, being more intentional about that as well. Trying to eat more fruits and vegetables, more things that with tamoxifen, there are certain things that you can eat that are really great for you. You know what I mean? That work well. So I met with a nutritionist. I'm like, I'm taking this drug, like what's gonna, really, really work well for me. So just kind of being more thoughtful about things like that. Always have exercise, but doing more things like I don't know, walking, getting outside, being in nature, that kind of thing. So yeah, I would just say being just more intentional about everything, especially like chemicals that are everywhere. Just kind of trying to get a handle on that.
I want to add one more thing since you just said tamoxifen, because a lot of women are on tamoxifen, and it's an estrogen receptor modulator. It basically blocks the estrogen from binding to the receptor, but it does that to prevent and lower the risk of recurrence of breast cancer. However, it does stimulate the lining of the uterus. So if you are on tamoxifen, you want to have regular pelvic ultrasounds. And if that lining gets thick, or there's a polyp in there, or it thickens, you need to have a biopsy of your uterus. Sometimes that gets missed because doctors are busy. They forget the patients are on tamoxifen. I do a pelvic ultrasound twice a year on my patients with tamoxifen. Usually patients have to take it for 5 to 10 years. So it's important to do that pelvic ultrasound at least once a year and check the lining of your uterus. And if it's thick, make sure you biopsy it.
Can I also say something about, because I have so many women come up to me now with horror stories, right, about their treatment post-cancer and, tamoxifen or something they've been asked to do or whatever. I would just, as individualized as you can make your cancer treatment, like that's really, really important. Like you don't have to, not everyone has to take, let's say, a heavy dose of tamoxifen for 5 to 10 years. You might be able to take a lighter dose for 3 years or whatnot. As much as you can sort of run out all those ground balls with all that testing, you don't automatically have to do radiation. You might not indicate that radiation is necessarily going to help you. I just think as much of the individualized, personalized follow-up as you can have to your cancer, I do think that's really important. Right?
That's really good. 100%. And every cancer, I always say your cancer has a driver's license. It tells you how aggressive it is, how likely it is to metastasize. Does it respond to hormones? So you need to know that information, and you have to listen to your doctor. I will end with that, because you have to listen to your doctor. That's what we do for a living. We've seen so many patients with similar pathologies, and we know how patients react. So even though some of these medications have, side effects, I still get hot flashes on my aromatase inhibitor. I mean, as I'm sitting here,
I know she does. I'm always I'm fanning her over here.
I'm like, it's hot, it's cold, it's hot, it's cold. I know. Exactly.
I had a friend yesterday who came. She's an actress who's about to be on this big TV show, and she's not. Yay. She's 45. I know. I'm so excited for her. She's 45, and she said, I've been shooting in Texas, and I come here, and like every conversation is all about perimenopause and menopause and hot flashes. She's like,
I know.
She's like, are we blaming everything on this? I'm like, basically, yes. Basically, yes. Well, you guys, thank you so much. This was very informative. Thank you, Hannah. It's so great to meet you. Thank you for all you're doing to help women out there by using your platform.
You're amazing.
Thank you guys. Thank you guys for doing that. I mean, we just keep trying. All right, we're going to fix it.
That's what we're going to do. It takes a woman. It takes a woman.
One woman at a time.
Come on. Thank you, ladies. It was a pleasure being on your show. Thank you.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD.
This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.